Yeah, good point. Okay, so I will say welcome everyone to our March health policy SIG meeting slash presentation slash discussion. And I'm really hoping, and I'll actually be the person giving the talk. I'll share my screen now and see if we are back where I want to be here. Share screen. I think it was this one that worked. Yes, excellent. And I'm going to talk on this particular subject of prediction and health policy. It doesn't really tell you exactly what the talk's about, but I will share a kind of an abstract and let you read it in just a second. And I'm hoping that this can turn into a discussion and sort of kind of just, reflection on, okay, is this important? Should we be worried about this kind of stuff? So I see that I need to figure out how to advance the slides because I don't have focus where. There we are. Okay. So I'd like you just to read this. It'll take a minute. It's kind of, it gives you my thesis. I guess I'll just read the last one, depending on how quickly people read. I believe we must absolutely hold back at least a few of the recent data points, which means we must blind ourselves to these data, calibrate our model without any knowledge of the most recent data points, both in the initial manual phase where it's absolutely critical that we're blinded, and later during optimization-based calibration machine learning, which is usually some sort of hybrid between, us and the computer algorithms. And then we must measure. Maybe we don't have to do this, but I think it's very valuable to measure how well the model anticipates future data points. And this is not a given. This may seem like a no-brainer at first, but it's not, because you could very well get useful policy insights from a model that didn't have a great baseline, but it gave you pretty good information about the relative efficacies of different policies. And that's kind of the main idea here. And that's why it's a discussion, not a foregone conclusion. What I'm going to do for the first 20, 30 minutes. I don't know how long this is going to take. I don't want to go super slow, but I don't want to go super fast. I'm going to show some examples, work that I've done, and then I've gone back and looked to see how'd I do. And it's pretty scary to do that, actually. First couple are two very similar models related to health policy directly, but to kind of make this a little bit more general, I'll talk about a biomedical model that I've worked on in the past and also a fisheries model some time ago. So the opioid epidemic modeling work that I've done in collaboration with many others, including Jack Homer, importantly, two models. Back in 2015, we published a paper. And then again in 2020, Jack and I published a paper with a very much enhanced, improved model, in our opinion, anyway. And we used all the available data to calibrate the model. We felt that we just had to do that. All the interesting stuff was going on right now. So if every data point we could get on influenced our thinking about how the model should work. And so that we didn't test the prediction capability. And we already know, just without having to go look closely, we know that our early efforts didn't anticipate fentanyl, which has completely changed the impacts of the opioid epidemic in ways that we didn't see coming. So maybe that's just the way the world is, and we have to accept that. But what are the implications? So I'm not going to dwell on the models themselves. This is the model from back in 2015. The work was actually 2013 and 14, and it was published in 2015 in American Journal of Drug and Alcohol Policy. And you can see that there's a flow of persons from people who are susceptible to drug use through to maybe becoming heroin users. And this is very simplified overview. This is not a computable version of it. But one of the key things that we were working with was we thought that the opioids that were accessible in medicine cabinets were helping to fuel the epidemic. And that turns out maybe to be a very small effect in retrospect. But at the time, we were focused on that. And just to give you an idea, just scan over this, you can see that we had some data. We worked on getting data, and our mean absolute percentage errors average around 10% overall. That seems pretty good, actually. And these are data sets that move around, they turn and jump. They're not just straight lines that we're trying to fit. And this were our policy projections. And the asterisks show what actually happened. This is the blue, compare the blue line to the asterisks. And you can see we were pretty good for a little while on recreational users. This is the people we thought we were trying to influence. People that's who might be getting drugs out of a medicine cabinet of a friend or relative, or their own, perhaps. And you can see we did pretty well. And then that kind of went off the rails. And so we were anticipating policies could go in that would make it go this way. And in fact, those didn't happen probably. And then it went this way. And then we looked at people who are more seriously involved in their drug use. Oral route of administration just means that they're shooting their drugs. So that could be prescription drugs that they've crushed up, or it could be heroin or something like that, or other drugs. And you see, we really we were off immediately. In fact, this data point came in and immediately it said there's something else going on. So, but it did say what the policy implications were, that these two interventions, one was on the supply, the drug takebacks, and the other one was on reducing leftovers at the end of prescriptions. Those would have fairly similar impacts. And so that was in policy insight. And it also showed that impact on persons with use disorder would be much smaller. Their needs are greater, so to speak. And our baseline projections, clearly, as you can see here, weren't very good. So that's the first one. This is a little more telling, though. If you look at those errors, I just took these numbers in here and I added them together because we were dividing the populations out in ways that data is not reliably collected. You can see that our errors were more like 50%. So we were about 10% off fitting to history, but when reality unfolded, we were off by much, much, much more. Which raises the question, though, which I sort of hinted at earlier: does an inaccurate baseline invalidate policy guidance? That's a great question. Okay, let's update to a little bit closer to the present now. This is Jack was really the lead author of this model, and we worked very closely together on it. But he was the primary guy, and he's a terrific modeler. This doesn't show the complexity of the model. There's this is a big project with a fairly amount of funding and people helping us collect data, and we did a lot more. There's a lot more, and you'll get a feel for that in just a second. But this shows that we're really looking at drug availability, street use in particular. We were focused more on the street than on, say, the medicine cabinet, which is, people don't normally pay for those drugs. They get them given to them. And then there's a bunch of different categories in here. I won't go into it, but they come into they initiate, they might die, they might quit, or they might stay in there, move around, and change from different drugs to heroin from prescription opioids. And you can see there's a lot of feedback loops here. I don't detail any of that. That's not the purpose of this talk. But we were looking at a lot of outcome time series. I think we had like 4 or 5 of them previously. Now we're looking at a dozen things that we're trying to match simultaneously all over the system, kind of on the exterior. We're trying to build a model of the interior of the system. And you can see here that the mean absolute error over the mean, that's a pretty popular metric and a useful metric, and fairly intuitive, but it basically says you're comparing to the mean value. So if the errors are big, but the mean's high, then you don't hurt yourself for that, which just makes total sense. It's around, I think we achieved 9% was our average MAEM. That looks pretty good. And all kinds of stuff. We're looking at the number of users, we're looking at deaths, we're looking at overdose events and things like that. So here's this. It took me forever to get this actual data on here. I worked hours and hours just to get these few data points. So here's my asterisks again. We did pretty good on the non-medical users. We project it out when there's a lot more data coming, and it looks like we're kind of on the mark for that projection. I could only dig up one actual data point, and it doesn't look horrible. If you look at the MAPE, it's mean absolute percentage error on this one. It's pretty high. And but then we don't do so well over here on heroin users. Things just went off the rails in this category of drug users. And so we were projecting, it looked like a turning point was coming. We couldn't fit that spike there with the logic, endogenous logic in our model. And we thought and this data point was telling us, yeah, I think that was sort of something, but we think it's going to go this way. And where it went was straight off the chart. It's in a continuation of that trend almost perfectly. So, a statistical model would have said, hey, if you just extrapolate that trend, you'd be a hell of a lot better off. Yet we tried so hard to get the endogenous logic to help understand the ebbs and flows inside. You can see here, I won't go to too much. You can see the picture. We're off really far off here. The data shows here, we're predicting that it goes down dramatically. This blue line, we're predicting that it's going to go down, even though the last data point's above there. And actually it does go down, but now it's back up here. I think our level is too low, and that's fairly significant error. And we were way, way off on the heroin initiation. People weren't initiating heroin. They were tending to initiate prescription opioids. We know this. We know it better and better as time goes on. So these data points down here, it's really hard to read. These 3 data points down here go with this orange series, and these 3 data points here go with this red series. And then finally, overdose deaths. This is where we were, and the first 2 data points were right on, and then boom, fentanyl hit, and deaths went off the chart, basically. We didn't have that in our model fully. We had fentanyl in our model, but we thought that fentanyl was going to turn. It wasn't going to be so bad, and it got worse and worse. Predicting is difficult. So just a couple more data points. This is our policy analysis published just 3 years ago, and this number actually 3 years after the last data point that we had at that time, it's nearly double what our projection was. And this one, the overdose deaths, 40,000. That's a lot of deaths. It was double that. So what are my insights on this? First of all, there's no silver bullet policy. If you help one of these indicators, you hurt the other one. If you make it safer to use the drug, people are going to be less worried and be more likely to become drug users. But a multifaceted approach tends to help. Policies that reduce persons with OUD have a limited effect on mortality. If you focus on mortality, you need to focus on these 2 things together to do a decent job. Is that insight valuable now? These projections are not even close. But do these policies, this particular kind of implication may not rely so heavily on the accuracy of the baseline, but rather how well you can tease out how those policies are going to tend to move it. If the baseline were to be bigger, maybe you'd have more policy impact, So I guess, and here's the thing, we didn't test it or even attempt. And we had good reasons for doing it. In fact, Jack, when he saw what I was going to talk about, he said, Wayne, we had good reasons. And I said, yes, I know, Jack, but I think it's important to be kind of really, really heartfelt, honest with ourselves on this stuff. So I think we need to evaluate it. And the question here that I'm raising down at the bottom of this slide is, how would you go about determining the degree to which, and this is not that different from what the field has been asking us to do for decades, which is to analyze the effects of, for example, parameter uncertainty on our policy insights. So if our policy insights would be way different if we had more accurate information, then we need to know that. This is very similar to that and maybe identical to it, which is if our baseline model doesn't predict the baseline very well, but can it still perhaps tease out the relative importance of different policies, which would still be a useful insight for policymakers. And that, I don't know the answer to that. I haven't thought it through. Maybe some of you have. And that's why I want to make sure we get into discussion mode here pretty soon. What do you think? What are you learning? Where would you take this? And I guess I just said all this, that I put it on a slide, that I was thinking about it as we were looking at this slide. I think it's an important next step, is to think about how do we evaluate the robustness of a policy insight in the face of the likelihood of twists and turns and surprises coming at us into the future. I'm not sure what's going to take to do that. So now I'm going to switch to a couple of older examples just to show you that this problem isn't just in health policy, it's everywhere. This one, I'm not even going to show you the model, but basically we were trying to use a model. We were looking at this patient specific, models that could help us do a better job. And many people in our field have done some interesting work here. My colleague Ed Gallagher and many others have done some fascinating work on trying to improve medical treatment using system dynamics. And I've done a fabulous job, so I'm not in any way saying that. But our particular work was aimed at, we were looking at pediatric patients, and these people who had a severe injury or fall or something, and many of them were in a coma, and we were trying to figure out how to take better care of those people. And these patient-specific models were then used to predict the patient's response. So this is not, I'm not going to go over this slide. We did the optimization part over in MATLAB in this particular case. We didn't have the tools that we have today in Vensim. I could have done all of this in Vensim today, but actually this was way back in time when I was using Stella, and Stella did not yet have as rich a data management tools as it has today. So this just shows that we used some algorithms similar to what's available now in Vensim and other tools, and probably in Stella as well. And we basically said, here's all the parameters that we're going to adjust to fit the data that we have in one segment to see if we can predict the next time. Oh, by the way, I should say, well, these are real simple challenges. These are people, although they're unconscious, maybe we would raise the head of the bed or lower the head of the bed. That's known to have an effect on intracranial pressure. We would adjust gently within in an approved protocol the setting of the ventilator that's helping them breathe. And we said maybe we can learn how that person responds to those and do a better job of setting the head of the bed, of setting their ventilator. So that was kind of the idea here. And you can see here, this was an intervention. Okay, so I mean, this was a change in the head of the bed. And how does ICP respond? In some cases, we're looking at these were all head of beds, but some of the others are different. I'm not going to spend any time on these slides. You could just see that the model tended to show how the patient responded pretty well for this particular patient. There's a few spectacular misses. Here's one where the intervention brought the person here and the model didn't respond at all. Just missed that one entirely. And here's one where the patient's ICP, the model says they should have responded and they didn't, so not perfect, but overall the impression here is, yeah, this model might be useful, maybe. So yeah, and here's one where there's some response. And then, okay, summary. So the mean absolute error, MAE, of the model fit measured in the actual thing we care about, which is millimeters of mercury. Intracranial pressure is around 10, less than 10. Oh, by the way, I guess if you have questions while I'm going, like if I'm really going too fast or I'm being totally unclear, just grab the microphone and say, hey, Wayne, I didn't get that. Can you back up for a second? I would not mind at all having that interruption. It's also fine if we wait and have the discussion later. So what's clinically significant? A couple of millimeters of mercury out of, let's say, elevated calibration in a severe case can be 25, 30, even 40, which is and the person probably won't be conscious in that case. So this wouldn't be too bad. It's not great, but it seems potentially useful. And the question is it? Here, we had data that allowed us to test it. So here were different patients. Here was the best fit we got to intervention measured as MAE, mean absolute error, over MAE within the segment. So you can just measure the error in the way ICP bounces around, and we're comparing the degree to which we fit how you saw those things moved up and down, and then they had a lot of wiggling. So this ratio says if it wiggles a lot normally and we move it up and it's still wiggling, we need to take out the effect of wiggling. So that's what this MAE over MAE kind of measure is. So mostly, in almost all but one case, this patient was very different from the other patients, basically. We were able to uh, predict to some degree what was happening. But then when we tried to predict what would happen the next time, we did the exact same change to the patient an hour later. Raised the head of the bed. How'd they respond? Waited an hour. Now we came back and raised the head of the bed. How'd they respond that time? This isn't good enough. I'll summarize this here. So we were now 4 millimeters within the same session, and we were within about 7 millimeters, which is now becoming clinically not usable. And what was the reason? Oops, sorry. I have to figure out how to go back. Oh, I don't know how to go back. Oh, previous. Sorry about that. I hit my mouse wrong. Patient non-station, I was trying to highlight that. Patient non-stationarity. The same patient with the same intervention responded the opposite an hour later. And one of the most bizarre things about this was quite a few years ago now, but I'll never forget. There was a time when there's a bizarre thing happened on our data, and we said, well, why did their ICP change so much? It went down. Their mom came into the room. That's what the physician said. The mom came into the room and their pressure went down. I didn't have that in the model. Did mom come into the room? You know, it was just fascinating. And this prediction error is too large for it to be clinically useful. And frankly, I threw in the towel at this point when I realized how much not. Now, there were people publishing data that was way better than mine. So somebody else had models that could do this. There was this guy in Italy, Mauro Ursino. He was getting amazing results, but then I don't know, his model was way fancier than mine, and maybe that was the secret. But I stopped. I said, this look with that much non-stationarity, this is a pipe dream kind of. The next example. Yeah, I think I'm doing okay on time. I do want us to have a discussion about what I'm throwing out here onto the table. Fisheries, this was even earlier. Fishery population, many fish over many decades, way back in the 60s, the Magnuson-Ferguson Act started to really try to regulate how much you could overfish a fishery before you stop fishing. And the purpose was to determine the predictive utility of fishery policy models, kind of like we've been trying to do with opioid stuff and also the treatment model for biomedical stuff. So we calibrated a system dynamics fishery model. I'm not going to show it to you. It's a very classic model. Lots of people have built pretty neat looking fisheries models that take into account fish populations and how fishing affects those populations and how you might go about intervening in those systems. Make projections, then get new fisheries data. So the work was done in the early 2000s, and this data hadn't emerged yet. And then I went back a few years later and checked. I did this work and actually presented at a conference, I don't know, almost 10 years ago now. And then compared the predictions to the actual results. And these slides are a little clunky looking. But you can see here, just in model fit to data, this is not easy. The data, this stuff in purple or whatever that color, lavender, that stuff is jumpy data. These fishery assessments are not, they're known not to be too fabulously accurate. So you can see here we have a very different problem. We were able to get down around 10% average error, and here we're only fitting within 30%, maybe give or take 25 and 24 in some cases. So we already know this is hard. But maybe the models can still be useful. So let's kind of take a look. And now here is the predicted versus actual. And you can see that the actuals are the same data as before. We had most of this was used for fit. This line here kind of shows what we fitted and where the predictions went. And now I've kind of stenciled in here what was the errors here. You can see we were off by manifold errors. The fishery, the actual fish harvest just dropped, completely. We were really befuddled. So what happened? Yellowtail is this type of fish we were studying, was curtailed after 2002 for a reason we didn't see coming. Another commingled, the widow rockfish, was in jeopardy. So they're the same size fish. They're caught on the same gear. So they shut down the yellowtail to save the widow. What was going on? Model boundary. I was too naive Fisheries people might have said, no, you can't just model a specific species. You have to select an intelligently drawn boundary of fish to understand how regulations intervene with fish populations. So this was a wake-up call way back then for me that this is hard. And I guess my last, I think this is, I have some questions. This is almost my last slide. So this just underscores for me the challenges of predicting things. And I understand why we've been told don't predict things, but we do policy analysis, and they rely on some sort of baseline, which is, you can call it whatever you want. You can call it a projection. You can call it an estimate, but it's a prediction, darn it. So that's why this conundrum comes up and why I wanted to have a conversation about this. So back to what I said earlier, does useful policy analysis require accurate baseline projections? I'll call them projections to avoid the stigma. But what about some kinds of models? You're not going to treat patients with models that can't predict what's going to happen. That's ridiculous. But could you do useful policy analysis? And the answer may be, hell no. Or maybe it's maybe. I don't think it's for sure a yes. It's at best a maybe. But could a model with poor predictive ability still be capable of gaining useful policy estimates? That's what we need to find out. And I'll sort of close with this. Which is better, using all of our data for model design and calibration, or blinding ourselves to a portion of it to enable testing of predicting capability, or the ability of our model to establish that baseline? And if the baseline doesn't matter very much, maybe we're better off putting all of our data into the model to build as good a model as we can based on everything that's happened right up to the present. And unless we need to go back to the slides, I'm going to stop sharing so we can all see each other. And I'd like to know what you think.
I want to comment on the data part where you talked about putting all the data or part of the data in. We have a model, we're working on a collapse model. And our model fits the data for the first 120 years. If it's a little worse for the second 130 years, and then it doesn't fit very well at all for the next 25 years. So that tells us that we're missing something at the end of the period. So I think it's useful to look at your model and do the calibration at different periods and see if they change. Of course, you make an assumption that, and we make the assumption, even though 120 years is a long time, that the parameters are constant, but some of the parameters are time varying. So you don't know that. So I think I'm not talking about the policy part. I'm talking about understanding how the model fits the data. And if the assumption that it should fit everything, maybe it doesn't. But if it does, if the parameters don't change that much, and they really haven't for the first 150 years for us, the first, they're pretty much the same. It's just later they get a little off. So that's one thing, to be confident in the model. But I don't know how you can predict uncertain things like fentanyl. Those are events. You can't. All you can do, I think that where your model doesn't fit, it gives you feedback on the model. Right? It just tells you, oh, this isn't quite right. You do the best you can, and use what you have. I'm not sure how that relates to policy though.
I mean, all models are under the assumption that everything else stays equal.
Yeah.
I mean, that is the only way in which we can do any predictions is, that we've got the right model structure, and that model structure tells us something around what's going to apply in the future. And if something dramatic changes, that sort of shifts the whole system out of kilter, then, the best model probably can't do very much. I mean, we can think on what those things might be, but we'd struggle to explicitly model any of that. But I mean, it's quite common, isn't it, to hold back data? It's, the typical split half methods that people use in validation in most areas. So, that didn't seem particularly a particularly novel idea. So I don't know whether it's just not very much used in this field. But it seems good practice where you assume that an older time series would represent the underlying dynamics well enough, and where you have enough data. I mean, it doesn't work, of course, with things like COVID, where all the data is really new, and you've just got to use everything that you can possibly throw at it, because it's just not enough known. But for things that are more stable and unlikely to have changed very much, then that seems an inherently good idea to do that, and to check where, if your prediction goes wrong, to reason about what that might be and what you might be missing, obviously. So all for it.
Thanks for your thoughts. I would say go ahead. Whoever's got their hand up first, like Hessam has his up, and then Deb has hers up.
Sure.
Just grab the microphone, and then when you finish, the next person grabs it. I don't need them really moderate it. We can just talk kind of informally, a small group.
Sure. I just want to raise 2 points here. One of them is that one of the PhD students in our labs, working with Naveed, Dr. Naveed, she is, I think, working on the same question, essentially, maybe with a little bit of a different approach. And I believe that she's already submitted to the conference, so she'll be presenting it in the conference too. What she's working on is she's using a COVID SEIR model with the behavioral feedback loop from Naveed's model. And she's manufacturing data with introducing noise into the model. So the data is synthetic. And then calibrating the same model with the synthetic data with different length of availability of data to see if more data is actually better. And the results shows that in some areas of this problem space, actually more data damages the parameter estimation in the end.
Fascinating. Wow.
Yes, it's an interesting one. I know you will like that.
I will love that. Yes.
Yes, I will, with your permission, of course. I'll send the recording of this to her and Naveed. I know she had a class this morning, so she couldn't attend. But you will enjoy the conversation, both of sides. So that's
Excellent.
one. Second point I wanted to make is that even in the events that are very unexpected, like the change in the rule, like we couldn't predict it in an endogenous way in the model. I still believe going through the hassle of modeling, calibrating, and predicting gives us that counterfactual in the real world, gives us that scenario that now we can compare. So that like this banning of phishing, how much did it actually contribute? Now you can compare it to the baseline of the model. If the model is well done and well calibrated, it creates a baseline for that policy or that regulation or that change. So I don't think that it's ever not useful, not beneficial to go through this, but I still believe that for the sake of prediction, it's a valid question to ask, very important question to ask, what you're seeking. And thank you for the presentation.
I love the question. I think it's really important. And I agree with what everybody has said so far. I guess I had 2 thoughts. So first, right when you were just talking about the opioids, your model sort of went off the rails when COVID hit, right? And we know that changed everything, right? I mean, it was a completely different thing. And then in your other 2 examples, like the mom coming into the room and then the fishery, well, this exogenous, the fish. So the examples that you gave are all ones where some sort of like, almost like Deus ex machina, like some totally weird thing happened, like once in a century, right? So I guess one question I have is, when you don't have examples like that, how well, how does this strategy work? So that would be, one question that I would ask. And then, what was my other one? Oh, I mean, I don't, so I'm not a modeler, right? I rely on people like Pascal to help me with these things. But so I know, like, where does sensitivity analysis fit into this? So, can you throw in some like crazy thing and see what that does? So that would be, just sort of, and I don't know if that's makes any sense or not, but that was a thought that I had. But I definitely agree with what everybody else had said before. And I think this is a very important question.
Well, I'll react to both of those. What occurred to me is that this, I would argue that it can't hurt. It can't hurt to know more about this, about how well our model can predict recent data. It can't hurt, and it might help for sure. So it becomes a resource, a time trade-off. It takes a lot of time to do this, in addition to everything else we do, which all of which takes a lot of time. So the question becomes, if it can't hurt and might help, go ahead, respond to that, Deb.
Yeah, so I had another thought, which is, so in my research program, in a lot of research programs, we start out failing a lot, right? And we learn from those failures, and then that helps us get to success. And for each one of these models, it was like a first research study that you can learn. And I think that we sort of move on, maybe, and that like when I'm building a program of research, I'm expecting, like right now I'm writing up a study, where, we tried an intervention. It did not move the primary outcome 1 iota, like not at all. We went from 2.3% of the time to 2.6% of the time, right? And I was only aiming for 10%. But not at all. But, we had a lot of like process measures, and that gave us really important information that's going to help my thinking going forward, right? When I write a whole nother grant for a whole, that's going to take me from the time I write it to the time I finish it, another 6 or 7 years, right? And I'm sticking with the same idea, and that's just 2 grants in the program of research. And I can imagine doing more. And so I feel like I wouldn't have too high expectations for when you're doing something the first time.
I guess for me, the key thing is, the confidence with which we give recommendations, because this stuff obviously is not just for our own academic pursuit, but there's lives depending on it, or policy implementations, at least, that could be very costly. So for me, the struggle is always, when do you know that something is ripe to bring out beyond the sort of academic sandpit into the real policy decision world, where you really, really don't want to get it wrong, because if people spend megabucks on the basis of your completely wrong predictions, then it's just unethical. And for me, that's hard, because we don't know. Even if you hold back data and the next few data points are perfectly predicted, it might still be something that comes along that's, so for me, I guess I'm a heretic in saying that. For me, it's still not so much about the actual values that you predict, and more the thinking aid that the models provide as you develop them with your stakeholders, and that the actual numbers that come out of it are almost certainly going to be wrong to degrees that we can't say in advance. I mean, it would be really nice if we were much closer to, say, weather systems, physical systems, but I mean, it's the social world, and we're just not nowhere near that kind of precision. So the question is, how much value do we place on the numbers, and how much value do we place on the process of developing the numbers, and the engagement of thinking through options and working out how the system might be working, and how well that fits, sort of as diagnostics. What do we know about the system, and how much does the data that we actually have corroborate what we think about it, and reasoning around that? I mean, I think that's a really good thing. But in terms of predictions, I've got serious worries of whether we'll ever be able to predict social systems well enough to be practical.
But it certainly suggests a high degree of humility with what we've done. And I think we've all learned the hard way, and we tend to soft pedal. We don't overclaim, but I know my students overclaim all the time in the work they submit to me. So, it is something that, we want to be confident. We want to be excited about what we've done. And then we might forget to say, oh, but wait, it's probably wrong. But what's wrong? And that's the key. Is it the policy advice that's wrong, or is it that the model can't predict uncertain event, the uncertain future, which we know to be true anyway?
The world's just wrong. It shouldn't be allowed to do things that we can't predict.
I also wanted to go back to policy sensitivity, which has been in the field for decades, many decades. I mean, people started talking about policy sensitivity back. Well, it's certainly well discussed in Sturman, and he was summarizing work from the 80s. So in some cases, so I think maybe this is a lot like the question of policy sensitivity. And maybe we have to dig a little bit deeper, because I think mostly we were worried about just parameter uncertainty, and then how does parameter uncertainty affect it? And this is maybe almost the same thing, but it's more model structural inadequacies, and how could those affect policy recommendations? So I think there may be an opportunity. I have to go do my homework. This is me talking. So I didn't give any citations or anything. This is an early stages of an idea. But I think there might be something here, and I'll learn from this video and all of your feedback, and go back and do my homework and say, maybe take it a little bit farther. It's not going to be, it might be worth presenting at the conference in an improved version of this talk a little bit, but it won't be ready for prime time to go into the journal or anything until we go back and look closely. Who's already worked on this? Who's already helped to identify it? And certainly go back and understand the degree to which the policy sensitivity recommendations that our leaders have provided for decades now, to what degree is that really, this is just another kind of another spin on that of some kind. And if I can answer that question, then I think it would be a contribution to the field. I don't think it's quite ready yet.
So what do you mean by policy sensitivity?
Well, to what degree would the policy recommendation change? Let's say I'm trying to decide between these two little policies that we looked at back in, almost 10 years ago now, which was drug takebacks versus what to do about the, I guess they're almost the same thing, but how do we, let's just say we have two different ideas for whether we should do this or that. We have limited budget. Should we give all the money to one, all the money to, so, but then how much does that recommend? I mean, if your model is way off on the baseline, but those two outcomes don't change, then it's policy, the policy is insensitive to the exact quality of the prediction that we use to drive that policy. That's, I mean it in a very simple kind of way, like intuitive way, like would the policy actually change? And the reason that's so important, and we've been told this since I was young, is that if it doesn't change the policy, then don't worry so much about it. If you can confidently say this policy is going to make the world better, even if the world is very different or darker or brighter than we thought it was going to be, it still moves things in the right direction and to an appreciable degree, then I think we can use our work, the body of work, like Deb was saying. It's not just the model or its numerical accuracy, but everything that we've learned to say we really should not prescribe, we should put drugs that are really dangerous on a short leash. They shouldn't get very many of them. Dentists used to prescribe 30 pain pills for toothaches. Good grief. We know that's stupid, so anyway, yeah. So that's what I mean by that.
Is that about like when you create a model, a lot of the insight comes from what the people people who are helping you create it learn from the process of creating it. And that in effect may change their ideas about what to do next, regardless of what your model says, the results of your model.
Yeah, but even is that good? I mean,
yeah. Well,
it's hard to evaluate,
So so I bring into the fact, what do psychological factors come into effect in a lot of these things? That included, or when you talked about the man in the hospital, when his mother came in the room, there was some psychological effect going on in that particular situation.
The child was unconscious. How did they even know she was in the room? This is, spooky kind of.
Oh, maybe the odor, sometimes people smell.
Well, sure, we know when people in comas have a lot of people there. I don't know that we've ever done a completely good study on that, but there's a ton of stories that people who are well attended during that coma it appears to be more likely that they're going to come out of that coma. I don't know that there's been a good study on that, but anyway, so yeah, that's kind of what seems to be going on. what would you recommend I do next in order to do the most useful things? I don't want to go spend, Jack sort of implied, Wayne, you're already going over stuff we already know. And so I said, well, I think I'll try to put another spin on it. What's your recommendations to me to make this even more useful for our community?
To make what useful?
Well, I've
I've
thrown
done a
out
lot of
this.
things today.
Okay, well, I'm saying that we should test the ability of our model. And you sort of elaborated in a nice way. You said, well, we should probably understand how well our model works in different epochs of the story,
Right.
and not just be settling for the overall result, the best result with all the data in. So I think that's part of what I want to recommend. And the other part of the recommendation is, or what I think I need to do, is to go back and try to answer this question. What is policy relevance or policy utility? What is useful to decision makers? How does that connect with how well the model can establish a plausible, ended up being realistic or true baseline? Or does the baseline really not matter very much? And I think there's got to be some empirical things I can do to try to answer that question, but I haven't thought through it fully.
I feel like you need more variety of examples where they're not all these things where some like thing came out of left field. Right?
Wait, that's the body of my work in the last few years. All of them have done this to me.
Oh, yeah.
How about you?
I get it. But, right. But yeah, I think that you need to have a range of different kinds of models. And not just ones where something came out of, because that's a really, really challenging situation when you have something that comes out of left field, but that doesn't always happen.
It'd be nice. It'd be a nice grant for someone, I suppose, is to say, okay, we'll take 3 years worth of simulation conference, the models that were presented, and or maybe the models that were presented but have made it into some kind of academic journal. So someone's looked at them and found that they're not completely bonkers, and take a selection of those, say 20, 30, but from different authors, different groups, different application areas, and actually looks at sort of what happened in the future years. Only models that made some claims about future development, obviously, because some are just built for explanatory purposes, but the ones that at least have some hope of representing something about future truth. And having a look, how well did they perform, and can not in terms of showing up people, your model was wrong, but in terms of what can we learn? Are there systematic things that we keep getting wrong? Are there things that we could have known when we built the models that they might be important in hindsight? And is there stuff that we can abstract for our future modeling purposes? So I'd get quite excited about sort of all this better validation, better dealing with uncertainty, better actually looking back, because we're so guilty of it was built, it was used for a purpose, and then we move on to the next grant on something completely different.
I also want to follow up on what Deb said. You talked about maybe looking at it by the type of model too, not just all models. Like the models that something really odd happened, that's one type, that they really thought something that really nothing really odd happened. Maybe your model wasn't good enough for some reason, or something is missing, So I think that categorizing by type and then making an analysis, Petro said, might be useful.
I would like to add that I think there are a few dilemmas here. So the idea of something coming from the left field, something very unexpected, that to me speaks to the dilemma of model structure sufficiency and data availability. So we're talking about if our model is seeing that endogenous thing happening, or sort of predicted that external thing happening, then the prediction would have been all fine there. So that's one dilemma, and that's a valid question and dilemma by itself. Then the second one, I think there's another dilemma here, and that is the I can't remember what I was going to say.
We've all been there.
Yes. Yeah. So it's I was going to say, when I remember it, I'll say it, but I was going to say that even apart from the structure and data, and okay, the second one is insight versus prediction. And I think we talk a lot about that in system dynamics community, that, you know, system dynamics is a lot better suited for gaining insight and understanding the complexities a lot of times compared to you know, predicting the outcomes. And that's, again, another whole field of question there. But I think even with those two addressed, the question of how much data, the more data is not necessarily better, that still persists even outside those two worlds. So I think, I don't know if I made myself clear, I went all over the place, but I think it's interesting to talk about, and the ideas that are coming out, I think they're very fascinating ideas. I look forward to hearing more about these.
Yeah, I want to hear more about more data being worse, because I've always thought more data just intuitively is better.
Yes, I will leave the punchline of that research to Anne herself to
Okay,
present
that
it,
sounds great.
maybe in this setting or in the conference, but yeah.
Yeah. Any other thoughts? It's perfectly okay to wrap up now, or we can keep yakking. I can turn the recording off if we want to go off the record for something or whatever.
Home time here in the UK. It's been great. Thank you for sending the link and the invite.
All right. Well, I think we'll call it good. Thank you very much. I'll close up the session and turn off the recorder. Very good.
See you. Bye, everybody.
I can't get the record. Oh, there it is.